Madam President, I rise today to join with my colleague from Rhode Island to talk a little bit about a very important piece of legislation we are introducing. It's called the Comprehensive Addiction and Recovery Act of 2014. I think it's fair to say that Senator Whitehouse from Rhode Island and I don't agree on everything in this body that comes up, all the policy issues, but on this one, we agree that it's necessary to develop and implement a comprehensive strategy to deal with this heroin epidemic that's sweeping across our country. He's been an unwavering ally in trying to find common ground on this legislation. I appreciate him. And again, I think this is an area where we can find common ground on both sides of the aisle and both sides of the Capitol, move legislation forward that can help to deal with this growing issue in our states. I don't think we can afford to wait. Every day, unfortunately, the number of people who die from heroin overdoses grows. Every day, more mothers and fathers, brothers and sisters, sons and daughters are lost to this horrible scourge. By the time this year is out, I'm told that more than 19,000 Ohioans will have overdosed on heroin or other opiates. The deaths from heroin overdoses this year will be the #1 cause of death in the state of Ohio, exceeding traffic accidents. Elected officials around the country, medical professionals, grassroots volunteers, are dealing with this issue. They're fighting back, and they're doing everything in their power to try to save lives and try to stem this epidemic. But they need help. The challenge we all face is serious, and to address it, we need a comprehensive effort, marshaling the resources of communities, grassroots organizations, local, state, and yes, the federal government. And that's where we come in here in the United States Congress. Together, and I think only together, can we make progress here and prevent new victims from falling into the grip of addiction. Only together can we help those who are already struggling with heroin to rebuild their lives. I think this bipartisan legislation we've introduced today is the important first step in that. It lays out a broad spectrum response to the epidemic of heroin and opiate addiction. It starts with prevention and education. Why? Because we know that approach can work. And obviously it's the most effective way to deal with this, to keep people from getting into the addiction in the first place. Nearly 20 years ago, I joined with leaders around Southwest Ohio to form what's called the Coalition for a Drug-Free Greater Cincinnati. I was here in the United States Congress on the House side. A constituent came to me and said her son had just died of an overdose of smoking marijuana and huffing gasoline. And I was ready for her. I had all the statistics as to what we were doing at the federal level in terms of eradicating crops in places like Colombia, interdicting drugs, prosecuting people, trying to stop the flow of drugs into this country. And she kind of looked at me and said, how's that going to help me and my community? How would that have helped my kid? And how does that help me deal with our church where people are in denial and won't even talk about it, or in our school where the principal said, you know, it's not a problem here. And so we came up with this notion of these community coalitions because there were a few around the country. They seem to be working. Ours in Greater Cincinnati has worked well. It's still working well. By working together with grassroots organizations across the spectrum, so teachers and parents, law enforcement, religious leaders, the media, business, we pulled together a group, and that coalition led to this greater effort that we started in the United States House and legislation that I authored called the Drug-Free Communities Act, which has now provided funding, by the way, and therefore helped to create thousands of other community coalitions. It's provided funding to over 2,000 community coalitions around the country. There are now about 5,000, I think, around the country. And those have worked, but they're not adequate to deal with this heroin epidemic. But we start there. We start with this notion that there is a way, through grassroots programs, more focus on prevention and education, to be able to help stem this growing problem. That's stopping addiction before it even starts. That, of course, again, is the most effective way, saves money, saves lives. We've also, though, got to do more to incentivize new and innovative treatment programs for those who have become addicted, to try to break the cycle, break the addiction. We do that in this legislation by encouraging diversion programs like drug courts that provide treatment alternatives to incarceration. We do it by funding evidence-based heroin treatment pilot programs. There's some exciting new medications out there that we think are worth trying. including some new medication that actually blocks the urge or the craving. We're funding evidence-based heroin treatment programs, but at the same time encouraging the use of emergency medications to stop overdoses, because this is something we've seen in all of our states. It expands the availability of naloxone, which is an overdose inhibitor, so that law enforcement agencies and other first responders have access to that to be able to keep people not from overdosing, which is happening, but from dying from that overdose. And we know that there have been many lives saved, even over the last couple of years, through the use of that medication. We offer more resources to promptly identify and treat incarcerated individuals suffering from addiction disorders by collaborating with criminal justice stakeholders and, again, providing evidence-based treatment. This revolving door in the criminal justice system of people who are drug users getting into prison, getting out again, and within 2 or 3 years, over 2/3 of them being back in the system, we're all paying for that. The communities are paying for it with increased crime. The families are paying for it. Taxpayers are also paying for it. $25,000, $30,000 a year for incarcerating individuals who, if you can get them into a drug treatment program, in part through these drug courts, in part through other programs that are proven to work, they can then not just get over their addiction and not be committing crimes, but become productive citizens and taxpayers themselves. We've seen this happen around the country. We ought to be encouraging that and supporting that at the federal level. I saw a model of this kind of approach when I visited Drug Comp Treatment Center recently in Columbus, Ohio, met with several nurses and counselors who are there on the front lines in the battle against addiction. They use medicated assisted treatment, but they also use a lot of counseling to help men and women get on this path to recovery. So it's not just the medication, it has to be a more comprehensive plan. And they do this in both a public health capacity, but also in connection with a prisoner reentry program. So again, people coming out of the criminal justice system who have a history of addiction, to get them into these programs so that they can not just get the treatment they need to get over their addiction, but also get the job training they need to be able to get back into the workforce to become productive citizens. We don't stop here in this legislation. There's one thing I've learned over the last couple of decades working in this area. It's that the best solutions to this are not going to come from Washington. They're going to be developed at the grassroots, on the ground. What we can do is support the efforts on the ground and provide states with more flexibility to be able to use the resources that are already coming from Washington. So our legislation does that as well. Our bill offers states that are proactive at enacting proven policies the ability to benefit from support under state incentive grants. These grants will reward states like Ohio that are improving access to drug abuse services for specific at-risk individuals, that are working to reach 100% compliance with programs like the Prescription Drug Monitoring Program that tracks prescription drugs. As you know, some states like Ohio, where we have a big prescription drug problem, there are also adjoining states, say in southern Ohio, West Virginia, and Kentucky, where there is this issue. And without a monitoring program, some people are getting prescription drugs filled in Ohio, but then going across the river to Kentucky and getting them filled. There's no way to monitor that without an effective program. We want to encourage all states to adopt those kind of programs so we know who is getting prescription drugs, who needs them, and who's abusing the process. We often talk about this issue of addiction in the abstract, and I've done that today by talking about numbers, 19,000 overdoses. But what does that mean? It's a shockingly high number, but we sometimes forget that every one of those overdoses represents a person, a family member, someone who has hopes and dreams, someone who at some point made a mistake, and now that mistake threatens those dreams, often devastates their family, as I've seen and I'm sure you have seen. Sometimes can even result in that person's death. As we talked about, overdoses this year will be the #1 cause of death in my state of Ohio. I want to share just a couple stories briefly before I close, stories that I've heard from people in Ohio. I've met in communities in our state that are struggling with the weight of addiction. I recently met a guy about my age. His name is Paul, and Paul came to a roundtable discussion and has been engaged in this issue because his son died of a heroin overdose. He was 19 years old. And by the way, he died of an overdose just 2 days after getting out of rehab. Sadly, that's not an uncommon story. People go into rehab to turn their lives around, and many are successful, but many aren't. And for some of them, when they get out, the temptation is just too great. Unfortunately, their body no longer has the tolerance for the drug it once did, and sometimes they overdose. His son was one of those. The guy has been in a lot of pain, and you can tell. still in a lot of pain. But where he has channeled his grief and his pain is in helping others to overcome addiction and to bring this discussion sort of out of the dark, to talk about it. It's not a comfortable topic for a lot of people to talk about, but he's been willing to do it, and to talk about his family situation and talk about the fact that every family ought to, around the kitchen table, be talking about this. We ought to be talking about it in the classrooms. We ought to be sure people understand the incredible risk and danger that our young people face today. Earlier this year, I met a young woman named Sarah. Sarah has been struggling to overcome her own addiction, and she's been successful in that, and I applaud her for that. She told me addiction starts in treatment, Rob, but it also happens in the community. You've got to have a surrounding that supports you and encourages you. So she's fighting her own battle, but she's also doing something interesting at The Ohio State University. She has started a student-led recovery program, kind of a support network among students. And again, often this is in the shadows. She's been willing to step forward and say, hey, I've got an issue. I'm a recovering addict, and I want other recovering addicts to come and join me and to feel support so that they don't do what Paul's son did. And there's Bill. Bill is in recovery from a heroin addiction that he told me used to cost him $2,000 a week at its height. And it cost him his freedom, too, by the way. He ended up in prison. When he got out of prison, he was able to take advantage of some of these programs we've talked about today, some of these prisoner reentry programs and treatment options, and Bill turned his life around. Interestingly, he now works at the very corrections facility where he once served. And as he joked with me, he said, I used to be behind bars, now I hold the keys to the cells. And I'm spreading the message. And I imagine he's a very credible spokesperson for that message. He's working with inmates to help build relationships and reentry programs, not just in the prison, behind the walls, but also in his community of Canton, Ohio. He encourages employers to give people a second chance, to give them a shot. His quote to me was, don't give them the keys to the safe on the first day, but give them a shot. It worked for me. It can work for others. So this battle against addiction will not be an easy one. We know that. But we also know that it's well worth the fight. We've got to take the fight. When we see the number of overdoses drop, when we see statistics showing that fewer kids are abusing drugs and more people are breaking free of the addiction that once held them, we'll know that it paid off. And it's not just about dollars and cents. Yes, we can save taxpayer money doing this, and we can ensure more people are productively employed and that our society is more efficient and that communities are safer. But that ultimately this is about our young people and what kind of future are they going to have. It's about our children and our grandchildren. Will they have a better shot at their dream, a better shot at getting through school, getting an education, a better shot at getting a decent job and being able to hold it, a better shot at being able to take care of their own families and having the dignity and self-respect that comes with that. And so ultimately that's what this legislation is all about. Again, I want to thank Senator Whitehouse for joining me to craft this legislation. I also want to thank Senator Leahy, who I understand has recently agreed to become a co-sponsor of this bill, and other members. I would encourage you to take a look at it. I think it's a good way for us to come together as Republicans and Democrats to focus on an issue that is affecting every single state represented in this body. Sometimes people are in denial about this, but the reality is it affects all of us as Americans.